There is a tablet known as Dimox. How to take it, whether it is safe or not.
Dimox contains a sulfur moiety in it, and many people are allergic to sulfur drugs.
High blood pressure and cardiac arrest is now very common.
Deaths due to these conditions are only because they are not acclimatized well, they are not physically fit, and they are climbing too rapidly.
Thought on smoking and consuming alcohol.
If you are consuming alcohol, it can be really risky. Smoking is again not a healthy thing for the mountain.
Welcome to the TTH house. I am Sandeep and we have a special guest today with us, Dr. K Sashindran. He is an Air Force veteran. He has climbed many peaks and trekked around the world, including many exploration trips in remote regions of Himalayas with the Indian Air Force. Today we will be talking about his amazing journey, few tips for first-time trekkers, those who want to go to mountains, how to stay safe.
Welcome, sir.
Thank you, Sandeep. Thank you. So let me introduce myself. My name is Dr. Sashindran and I served in the Indian Air Force as a doctor for almost 38 years, and now I work as a professor of medicine in a medical college in Mangalore. I am an infectious disease specialist by training, but I have an abiding passion in high altitude medicine. And this is because of my passion for climbing and trekking in the Himalayas. I started off very late in life according to my views. I wish I had started 10 years earlier, but in those days there were not many opportunities available. I had a love of outdoors right from my childhood. I grew up in a small town in Orissa, and there were teak forests around our house and there were rivers. So as a child we used to explore the forest and go to the river and play on the river. So I always felt very comfortable in the outdoors. It was only when I went to Armed Forces Medical College as an undergraduate student that I started climbing in the Sahyadris, and that was the first exposure to trekking in the hills. And then while I was in college, I had an opportunity during a summer holiday to go on a trek in Ladakh with Youth Hostel Association of India. And that was the first Himalayan trek that I had done. And that was the one which was a turning point. We started trekking regularly. And the next big trek I did was from Batal to Baralachala via Chandartal. And that was before there were any roads there. And it was like, when you got down from the bus at Batal, there was only one signpost, one stone over there and nothing else beyond that. So from there you had to walk. There were no people, there were no tea houses there. Till you reached Baralachala, you didn't see a single person. So it was one of those, and we were three of us carrying all our equipment, food, and for 2 weeks we were there on that trek. And that was when we discovered how challenging Himalayas can be. But after that we have been trekking regularly. I have trekked all over Garhwal, Kumaon, and then a lot of treks in Kashmir and also in Arunachal Pradesh. And over many years of traveling, we also trekked in Africa, in Europe, and in America. So had a fair amount of exposure to the mountains.
Sir, as you have a good exposure in high altitude medicines and fitness, so what is your tip for the first timer trekkers for their safety in high altitudes?
So the important thing to remember that trekking in the Himalaya is not like walking in a park. You have to be physically and mentally prepared. You have to do your homework before you come on an expedition. Now, physical fitness means that you should be able to at least run 5 kilometers a day without feeling tired. You need that amount of aerobic fitness to be coming on a trek, at least so you can start training, plan 6 months in advance, start running, so that you are able to run 5 kilometers, you build up enough stamina, and that would give you confidence to climb in the Himalayas. The other thing that you have to realize that when you are climbing the Himalayas, you also need to carry a backpack. And if you are going to carry a backpack, you also need to have strong back muscles and shoulder muscles. So build up shoulder muscles and back muscles, build up thigh muscles and hip muscles, because those are the ones which are required for you to climb. So invest in being physically fit when you come for the mountains. The next important thing when you come for the mountains is that you should be having the right gear. Now when you are climbing in the mountains, you might start off in the morning when it is hot and sunny, and you want to only trek in your shorts and t-shirt. The sun will go behind clouds and suddenly the temperature drops. Then you should be able to pull out a layer and put it on. And the whole trick of remaining warm in the mountains is layering. Having layers which are accessible to you, which you can take out and put on. Most young trekkers who come will not plan to carry 2-3 layers with them in their day packs. and that is when they get into trouble. So you should always carry a raincoat, a wind cheater, probably a fleece jacket along with what you are wearing in your day pack, so that you have multiple layers to put on if it becomes cold. The other important thing you should realize is that you should always have enough energy to climb, which means you are going to be eating properly. And this is a thing that you have to be very conscious about, because the moment you reach high altitude, the first sign of altitude sickness is your appetite goes. And most people do not feel like eating, they feel nauseous. So you have to be conscious that you consume enough carbohydrates basically to give you energy to climb. And always carry an energy bar or a chocolate bar or one or two of these bars with you in your day pack, so that when you feel tired, you can just stop and eat that, and that gives you energy to continue. So these are the things. And the other thing that I would tell you is to invest in a good pair of trekking boots. That is something where you should not scrimp on money. Get good trekking boots which give you ankle support, which are waterproof and which have good Vibram soles, because they are the ones which will give you good grip on rocks, especially wet rocks. When you're climbing in the rain or on snow, it will give you good grip, and that is very important for you to be able to climb.
Sir, high blood pressure and cardiac arrest is now very common, especially after COVID, and we have seen even in Chardham it has been reported like many people got cardiac arrest. So what is your thought on this, like how to manage all these things or fitness wise, and how COVID impact on the health?
Okay, so there are some important illnesses related to high altitude, known as high altitude pulmonary edema, which is where there is collection of fluid in your lungs, and the other one is high altitude cerebral edema, where your brain swells up with fluid, and both are life threatening medical emergencies. And deaths due to these conditions and people developing these conditions are only because they are not acclimatized well, they are not physically fit, and they are climbing too rapidly. So one of the important things is that whenever a trekking expedition is planned, it should be planned in such a way that there is a gradual acclimatization. Beyond 2500 meters, you should not ascend more than 300 meters a day. If you are climbing more than 300 meters, factor in an extra rest day so that people acclimatize. So acclimatization is very important. Next is fitness. Now all people should have their blood pressure checked, should undergo a good medical examination before enlisting for one of the high altitude treks. Now I will tell you, I have been a liaison officer for the Kailash Mansarovar Yatra. For the Kailash Mansarovar Yatra, they make you undergo a full rigorous medical examination before the expedition, which includes a treadmill test, a spirometry where they check your lung function, they do all your blood tests to know whether you're fit or not, and only then they clear you for the expedition. But that is not the end of it, because all along on the trail, as you are gaining altitude, they check your blood pressure every day, and if your blood pressure shoots up, they will send you down. And there is no argument on this. You cannot negotiate with them, because they know that when the blood pressure goes up, it increases your risk of developing high altitude pulmonary edema, other complications, so they do not want a risk. And it is not risk for the organizers, it is risk for you. So you should be aware that when they say that they are going to send you down, you should not fight it. Now, after COVID, we didn't realize, but later on we realized that there is something known as a long COVID syndrome. And a lot of blood vessels get blocked in different parts of the body, and which can lead to complications. So now more than ever, I feel that anybody who is coming or enrolling for a high altitude trek should undergo a treadmill test before being allowed to come on a high altitude trek. And they should be very open to the fact that you may start off on a trek, but you may not complete the trek. Because if you fall ill, your health is more important, you should come back. And it is not that I paid money and I must complete the trek. Even now, after almost 40 years of climbing, I always go with an open mind, that I may have invested a lot of money on an expedition, but I know that final determinant is my health all right or not. If I do not feel comfortable, I will have no hesitation about coming back. So that is important. So I think it's a very good thing for you all to incorporate in your pre-trek protocol, especially for a high altitude trek more than 4,000 meters, is that everybody should undergo a spirometry, they should undergo an echocardiography, they should undergo a treadmill test, and they should get you the reports. And you should check their blood pressure at all levels. As you keep going up, check their blood pressure every day. Now, there is a tendency for the blood pressure to rise when you're going up. Okay, but it will go up a little bit, say by 10 millimeters of mercury or 20 millimeters of mercury from the baseline normal. But if it goes up much beyond that, then that's not safe. You should ask the people to come down.
And sir, as you have a experience of 40 years in mountaineering and trekking, so you must have done it from your young age, and still this age you are doing and you are like a pro. So can you give any advice to the trekkers who are 50 years plus, or those who want to do trekking after 50 years and they are first timers? So is there any advices how to stay safe and healthy in the Himalayas and altitude?
So the important thing about people who are above 50 and who are trekking or who want to start trekking is that you have to be very careful of your health conditions. You know, average age today when diabetes and hypertension start in Indians is around between 35 to 40 years. So if you are 50, there is a good likelihood that you might be having either hypertension or diabetes. So first thing you have to do is to ensure that your disease is well investigated and you are on medication and your disease is well controlled. Your sugar should be well controlled, your blood pressure is well controlled. So that is one. Next thing is you should be reasonably fit to climb. And as you age, the important thing that happens in your body, one of the physiological changes is that you start losing muscle mass. So you know your muscles start becoming smaller and weaker. So it is very important for you to do resistance training, especially to build up strength in your thigh muscles, hip muscles and your leg muscles. And for this you should actually meet a physical trainer and ask for specific advice how to build up resistance, do resistance training and build strength in these muscle groups, because that will help you when you start climbing. Take all the medicines that you take regularly along with you on your expedition and continue taking the medicines. This is the important advice that I would like to give people above 50 who want to climb.
And sir, you have done trek in Himalayas in foreign countries also, where you have faced the problem related to food, veg, non-veg and other things. So can you give any advice like food consumption before the trek or during the trek, how we should go on our diet?
See, if you are going on a 8,000 meter peak expedition or something, then you want to build up fat reserves in your body because that is going to be an energy store. But if you are just going on a high altitude trek, you don't need to do all that. What you should do is you should be reasonably fit when you are coming for the expedition. And you should be very conscious that you should eat regularly and eat adequately during the expedition, because appetite is a problem like I told earlier. Now in most expeditions in India, the trekking groups offer vegetarian food, and you know, on an expedition if I am able to get dal chawal with sabzi, that is good enough for me, because that is a normal food, and if you are consuming normal food you are very comfortable and you can manage it. There will be some expeditions or when you are going to very high altitude where you need to consume pre-packed food or tinned food, and that time you might face some problems. You know, you might not like the taste and the quantity might not be adequate, and also you have to be conscious that you are eating enough. A lot of groups, a lot of people also want to have non-vegetarian food on the trail. Okay, it's good if you are able to see, you have a problem with digestion when you are on the mountains. Carbohydrate digestion is easy and energy gets burnt faster. The body takes a longer time to digest, protein meals and all that. So, you might feel bloated, you might have constipation on the mountains, which really make climbing uncomfortable. So if you're going to consume non-vegetarian food on the mountain, have it occasionally but not regularly. That would be my advice for diet.
And nowadays, like people are more into fitness, so they give more weightage to protein food as comparing to carbohydrate food. When they take too much of carbohydrate food, that comes in their mind like they will lose the muscles if they don't take too much of protein.
So you actually take a lot of protein when you are preparing to go on an expedition, because that is the time you are building your muscle and strengthening your muscle. On the expedition it does not matter. On the expedition, what is important is you have enough energy available for climbing, and the carbohydrate is the easiest source of energy.
Okay, sir, can you tell something about mountain sickness, because many trekkers are eager to know about mountain sickness, how it happened, how to prevent this? And most important thing, that there is a tablet known as Dimox. So their doses, how to take it, whether it is safe or not, what are the consequences of this medicine?
Okay, so mountain sickness, also known as acute mountain sickness, is a very common illness that people who go to high altitude face, and it is usually people from the lowlands or plains who are climbing rapidly to mountains who develop acute mountain sickness. Now, anybody reaching an altitude of more than 2500 meters from plains is at risk for altitude sickness. A classical example would be a person taking flight from Bombay or Delhi and going to Leh. Okay, the moment you reach Leh, you are at 11,000 feet and you are likely to develop acute mountain sickness. Now, acute mountain sickness, what happens is, as you go higher up in the mountains, the concentration of oxygen in the air becomes less and less. So when you reach around 2500 meters, the oxygen concentration is so low that your body reacts to it suddenly. And the first thing that your brain does when it senses that oxygen is less is that the blood vessels in the brain start opening up. They dilate. And that is the one which causes headache. And this is known as a high altitude headache, and it can start within 3 hours of your reaching high altitude. Apart from this, you can develop feelings of nausea, vomiting, loss of appetite. You can develop feeling of fatigue or extreme weakness. You can have lightheadedness or dizziness. So these are the other symptoms that come, and these are all part of altitude sickness, acute mountain sickness. So you have headache, which is the commonest and most important. Then you have weakness or extreme tiredness. You have loss of appetite, nausea, vomiting. And then lastly, you have lightheadedness or dizziness. And you should be able to recognize this. Now, the moment you develop altitude sickness, you don't have to get alarmed. You just rest in that place for 2 to 3 days. Most of the symptoms of altitude sickness will peak between 18 to 24 hours and then they will go away. So by third day, your symptoms would have gone, and by third day, your body would have got acclimatized. The important thing is, on the first day you reach altitude, you should completely rest. There should be no physical activity. Next day, you can start walking on level ground. Third day, you start climbing up, and then you are ready to climb. So you should be able to have enough time to acclimatize to altitude. Now, a lot of people will ask, are there medicines to prevent altitude sickness? Yes, there is a tablet known as acetazolamide, and the brand name is Dimox. And a lot of books, there are recommendations from many agencies that you take 250 milligrams of Dimox or 500 milligrams of Dimox on the day you are taking a flight or you're going to altitude, and it will prevent altitude sickness. Yes, it will do that, but all medicines come with side effects. And the common side effects of Dimox are that you get tingling sensation around your mouth, your tingling sensation in your hand, and it can be very disturbing. You will start passing a lot of urine, you may develop a lot of nausea. These are common symptoms. But there are some life-threatening symptoms because Dimox contains a sulfur moiety in it, and many people are allergic to sulfur drugs. And those people who are allergic to sulfur drugs can develop a severe allergic reaction which can be life-threatening for them. So you should be very clear, and you should have a discussion with your doctor and talk to your doctor about your drug allergies that you have. And if you have a sulfur allergy, Dimox is not a good idea for you. The other important thing that you should do when you are reaching altitude is to hydrate yourself well, because that will help prevent altitude sickness. So these are the two important things about altitude sickness. Now people will ask, okay, I have reached altitude, now I have to go high up. I am going to climb a peak. Can I take Dimox and keep climbing? No, it doesn't work like that. You can take Dimox for a few days till you reach an altitude, but finally your body has to acclimatize, and you have to let your body acclimatize naturally. You cannot take Dimox and keep climbing, that will not work for you.
What are your thoughts on smoking and consuming alcohol? Because we say no to alcohol or smoking, but there are, exceptions are always there. So there are few fit trekkers, those who go on trek and they consume all these things. When they come back, then that arguments begins, like you said no for all these things, I consumed and completed the trek.
Alcohol is a strict no on mountains, especially when you are climbing. One is that alcohol dehydrates your body and it increases your risk for developing altitude sickness. Second thing is when you are going to high altitude, because of the low oxygen concentration in the air, your mental process also becomes slower. A lot of people have problems in making decisions. Like if you are going up to say 20,000 feet, that is almost like 6,096 meters. At that altitude, exposure without oxygen for even 15 minutes decreases your alertness, decreases your concentration, decreases your reaction time, impairs your critical judgment. Now you are climbing a peak, and if you cannot take quick decisions and your reaction time is slow, that means you are likely to create errors, fatal errors on the mountain. Now in such a scenario, if you are consuming alcohol, it can be really risky. So alcohol should not be allowed on the ascent of an expedition. And I would really recommend that on an expedition you don't have alcohol. Once you return back to base camp, then go ahead and drink whatever you want. So that would be my advice. Smoking is again not a healthy thing for the mountains, because it decreases your lung function, and so I would not advise smoking or drinking on an expedition.
Can you tell something about the types of asthma, because we get more queries like asthma people also want to do high altitude trek. So how asthma affect trekkers or patient on high altitude, whether they are advisable or not?
This is a real problem which agencies like yours will face, that people who have asthma want to climb. An important clarification you should have from the client is his asthma stable? Stable means he is taking routine medications and he does not have any symptoms. And those are the people who, if they do not have symptoms and they are cleared by the doctor before the expedition that they are stable and there are no signs on clinical examination suggestive of an acute asthma attack, you can take on an expedition. But you have to advise them to carry their regular medications along, and you should also advise them to carry steroids along. So a good steroid to take is prednisolone tablets. So when they get an acute exacerbation of asthma, they can take the steroid tablets and then they can come down. Now a person who is having an acute attack of asthma on the mountain should not climb further, should be asked to come down. Now why is it important for us to know whether the patient has an asthma attack or not, or whether he is asthmatic or not, is because when you have high altitude pulmonary edema, which I told you is a life-threatening condition in the mountains, the lung findings when you are examining with a stethoscope are very similar to that of an asthma attack. So at that time it will be very difficult for us to differentiate between a regular asthma attack and one due to pulmonary edema. So if we are not making the right decision, the treatment will be wrong, and that could kill a person. And that is why I would like to know about the asthma status of a person.
So if doctor says the person is perfectly fit to go?
Yeah, so you should ask them to get a spirometry test done, and if the spirometry is normal, then they can be allowed to go on a trek. But people who have chronic obstructive pulmonary disease or who have chronic poorly controlled asthma, they should not be allowed to go on high altitude expeditions.
And what kind of first aid kit should a trekker keep always with them? Because at TTH we include medical kits like oxygen cylinder, we have a stretcher and common medicines for fever and diarrhea, everything. But apart from that, is there any advice like trekkers also should carry some kind of medical kit?
So a trekker, when he is walking for on a long walking day, for some duration he might be walking alone or with only one partner over there. So if he falls ill on the trail, he needs to take some medicines. So the common illnesses that you will find on the mountains is that they develop a headache. So you can take crocin tablets with you to have on the trail if you develop a headache. Other thing is you suddenly feel dehydrated or weak. So it's very good to take some ORS packets with you. So plain ORS, simple ORS, it doesn't taste very good. So you get orange flavored or lemon flavored ORS. So you take that with you. So you take some around 5-6 packets with you. The greater problem which you have most often is that when you are wearing new shoes or something, you get blisters on your toes, and then walking becomes painful. So you should be able to have some band-aid which you can apply on your toes over there. So you have an antiseptic lotion or a cream like a betadine cream which you can apply, and then you put a band-aid on the toes to prevent further blisters from coming. Apart from this, I don't think an individual should carry any other medicines, because as an organizer you are interested in is that you don't want people to keep taking medicines on their own, because you will not know how ill they are. So it is better that you carry a medicine kit, and you should tell all the people on the expedition that if you fall ill, come to us. Tell us what is wrong with you, we will give you medicine. Because then you are aware of who is ill in the group. That is very important for you to know.
Okay, and sir, you have done lots of trek like with the Air Force and with other organization also. We had words with your wife, like you both have done trek together. Can you give any insights, like when couples go for a trek, what happened in their personal life, and how it works?
Yes, my wife and I have been trekking together for a long time. I was trekking for almost 10 to 15 years before I got married. And when we got married, my wife had never done a trek in her life. She had never done any outdoor activity. So I was telling her that, I have to introduce you to trekking. So we got married and we immediately had children in very early stage of our wedding. So our first 3-4 years of marriage were only in looking after babies. But when our second child, our daughter, was 2 years old, I told her now she is old enough, she can stay with grandparents, let's go on the first trek. I will take you trekking. And the first trek was like baptism by fire, because I took her on the Annapurna circuit trek. Annapurna circuit trek is a 300-kilometer trek. And I was in those days only doing alpine style climbing. So I was used to carrying all equipment. And because she was doing a trek for the first time, I gave her a small backpack and I told her I will carry all it and we'll hire one porter. So we were only 3 of us trekking together. One porter who was carrying the kitchen equipment and the food. I was carrying my clothing, her clothing, and tent. So this is how we trekked on the first expedition. When we had to cross the Thorongla Pass, which is around 15,000 plus feet. Before that day, it had been snowing for 3 days continuously. And we were waist high in snow when we were walking up towards the pass. So after that trek, she told me that now I can climb anything in the world. If I've done this and survived, I can climb anything in the world. So, and then, once you have been in the Himalaya is like a magnet. Every year it will draw you. After that, we have been trekking regularly. So when you are trekking in the mountains, you want to have a good group of friends or good company with you on the mountain. Who is better than your own wife? So if you are fortunate to have a wife who shares your passion for the mountains, I think you are the most blessed person in the world.
To wrap up, what inspired you to get into the trekking, and how often you go for a trek in a year? And additionally, what are the health benefits for those who go trekking regularly?
So, I'm a doctor, and for a large part of my life, I've also been teaching medicine. And my field of work has always been with HIV/AIDS patients. So it is a very intense form of medicine when you are treating AIDS patients. You always feel that you are scared of getting burnt out. So you need to have a break from your busy medical schedule, medical profession and teaching profession, for you to recharge your batteries. And that was a great incentive for me to climb regularly. And when I climb the mountains, I find that it has a profound effect on me. Like, when you're standing in front of a majestic peak, you realize how inconsequential and small you are in nature. In the silence of the mountains, you can hear your inner voice. And when you are climbing up, putting one foot in front of the other and slowly climbing up, breathing with great difficulty to reach the summit or to reach the high pass, and you reach over there, you realize that your mind and spirit has won over your body. And then when you look around and see the magnificent scenery, you feel you are blessed, because you are seeing something which very few people have the good fortune to see. And these are great reasons why you want to go up to the mountains. We climb, my wife and I climb we do 2 trips per year in the mountains. And we have been doing this now for almost 20 years. And we feel that if we are not doing 2 trips a year, we are cheating ourselves of a good life. So that is our reason to climb. And I think that it is a great hobby to have, because we both consciously work out throughout the year, because we want to remain fit to climb on the mountains. We are conscious of what we eat, we are conscious of our lifestyle, and because we want to climb in mountains. So climbing or trekking can be a great motivation for you to remain healthy and fit.
So, regularly going to mountains or doing trekking, does it reverse your health issues?
See, I'm not sure whether it reverses your health issues, but it will help you control your problems better. Like if you are diabetic or you are hypertensive and you are losing weight, you are becoming fit, and you are eating properly, all of them will help you control your disease better.
Thank you very much, sir, and giving your inputs and advices.
It's been my great pleasure to trek the Himalayas. I've been climbing with you all for more than 10 years now, and I always find that we have a great experience when we climb with you all. The food we get on your trails are great, and as I was telling you earlier, I really like your guides because they are so knowledgeable, so honest, and so simple. And that's why I find that trekking with TTH is a great experience.
Thank you very much, sir.
Thank
It
you.
is a great pleasure having you here with us.
Thank you. My pleasure also.